Hi, this is Dr. Nelson, your Utah Wellness Doc with Freedom Healthcare, and today I want to talk to you about the difference between conventional medicine and functional medicine. Here at Freedom Healthcare, we feel it's very important to absolutely be well-versed and certified in conventional medicine and be well-versed in functional medicine. And I want to give some examples as to why we do this for our patients. Let's talk about some of the differences between conventional and functional medicine. Conventional medicine, and also I want to point out that both are imperative and both are very useful and helpful for our health and wellness. Conventional medicine is a bit more reactive in the way it approaches healthcare, and functional medicine is more preventive in the way it approaches healthcare. Let's take one example of this that is affecting us currently, the coronavirus, so COVID-19 and the syndrome that causes of an inflammatory pulmonary disease. That can be life-threatening. A reactive approach to this is life-saving. There's ventilator use, there's steroid use, certain medications have been helpful in certain patients, but it's when they get really bad that we start to use these. A preventive approach, we're hearing more and more about studies that patients who have a more severe reaction and a more life-threatening reaction to COVID-19, almost exclusively all of them have a vitamin D deficiency. So as a functional medicine approach to help boost our immune system and reduce our infections or the severity of our infections is to make sure we have an optimal vitamin D level in our blood. Vitamin D in this instance helps reduce the cytokine storm that causes our immune system to have a severe, uncontrolled inflammatory reaction to certain viruses. Okay, another difference between conventional and functional medicine is that one treats the symptoms and one tries to focus more on finding out what the cause is and treating the cause. Let me take an example of depression here. Let's say I have a patient who comes in late 30s, early 40s. They've never suffered with anxiety or depression, and all of a sudden it's really having a profound impact upon their life and their self and their family, and so they're seeking treatment for this. A conventional medicine approach is that we treat the symptoms with medications like Prozac, Zoloft, Wellbutrin, and all those classes of medications for depression and anxiety. These are life-saving medications for a lot of people, and they're very important, and it helps control the symptoms of depression. And another approach, which is equally beneficial and effective in a lot of people, is to look for the cause. So back to this patient who comes in never having had a problem with anxiety or depression, and kind of midlife area or 30s to 40s is starting to develop this stuff. I can use medications to treat the symptoms, but I can also look for a cause. A lot of times at this age frame, everybody's thyroid starts to take a downward turn after age 30, 35. Women start to lose their progesterone and also their testosterone. And I encourage you to look at my video on women and testosterone and the importance of that hormone in women. Men start to lose their thyroid and testosterone as well. And a reduction in these hormones causes a reduction in our mood and our enjoyment of life and our ability to cope with life's stressors. So if we can just supplement natural bioidentical hormones to get our levels back to optimal, they may still be normal, but at the very wrong end of normal. And if we can supplement those back to optimal, we can help treat the cause of the depression. Let's talk about another difference. Conventional medicine's job is to maintain health, and functional medicine is more focused on trying to restore health. Both are very important. Let's take an example of osteoporosis here. Happens more frequently in women than men. So let's say there's a patient that has a family history of osteoporosis, and she just goes through menopause and comes in to see me, gets her first DEXA scan because she knows her family has osteoporosis. And lo and behold, she's got osteopenia or osteoporosis, and she's confused because she's thinking, I just barely went through menopause. I thought that estrogen is what prevents osteoporosis. And so, lo and behold, she's got osteoporosis. What do? Conventional medicine's approach is to use drugs called bisphosphonates, which slow down the bone breakdown. They do not reverse osteoporosis. They do not halt it. They slow it down, which is great. But those drugs can have some side effects as well because they are synthetic medications. They're not natural to our body. Well, a functional medicine approach is to try and restore the health. So what has caused this patient's osteoporosis by the time she's 50? If you look back in women about age 35, their progesterone starts to go down and their testosterone starts to go down. Testosterone helps maintain bone density, but progesterone in particular activates the cells that produce and build bone. And if their progesterone levels have gone down, they have stopped building bone at around age 35 or 40, and by the time they're 50, they have osteoporosis. So it's not just the estrogen. If we replace natural progesterone in women, which has a multitude of benefits, it will help restore their bone health. And I have seen many patients not just slow down their osteoporosis, but actually reverse it. And their DEXA scans get better and better until they become normal again. Moving on, conventional medicine versus functional medicine. Let's talk about, what we use to treat patients. There's synthetic medications which have done a lot to prolong our lifespan in the United States. And natural medicine takes more of functional medicine takes more of a natural approach. Let me just give one example here, like high blood pressure. As we get older, we develop high blood pressure. Some people a lot worse than others. Some people not at all, but some quite significant, which can increase your risk for a heart attack and stroke and end your life early. The synthetic approach there has been life-saving and life-prolonging for millions of people. Beta blockers, ACE inhibitors, angiotensin receptor blockers, multiple blood pressure medicines that are very good at reducing blood pressure and reducing these significant life-ending or life-altering events. A natural approach would be to take a look at a hormone level. After age 35, everybody's thyroid starts to go down. When our thyroid is at the bottom end of normal or below normal, our arteries start to harden and the lining of our arteries becomes less healthy. So if we can restore that thyroid up to optimal levels, then we can help improve and reverse the progression of the disease. Another approach here would be in addition to using synthetic medications, we can use things like L-arginine, which is a natural supplement that has minimal to no side effects in everybody that uses it. And it helps restore the health of the lining of the blood vessels, which will help restore the elasticity of the blood vessels and lower blood pressure. So functional medicine is incredibly good at prolonging our life. Conventional medicine is incredibly good at prolonging our life. Functional medicine is very good at prolonging our wellness. And here at Freedom Healthcare, we care about our patients. We want you not only to live longer, but we want you to live healthier during that long life. And so we all specialize in both conventional medicine and functional medicine here at Freedom Healthcare. All of our providers, whether they're doctors, nurse practitioners, physician assistants, are specializing in both.